So the first thing that we're going to do is do a mobilization with movement to improve active elevation of the right shoulder. And this is my patient here, you can wave. And he's having trouble lifting his arm, so you can go ahead and show them how far you can lift it. And do you have pain with that?
Yeah.
So we're going to go ahead and work with that. So I'm going to do a mobilization with movement of the right shoulder. I'm going to come around and stabilize his scapula and apply a posterior lateral force to his femoral head. And I'm going to go ahead and ask that you go through that motion one more time. And back down. And one more time. And how does that feel?
Feels better.
Does it feel better?
Yeah.
All right, put it back down. And one more time. And back down. And did you have less pain with that?
Yeah.
All right, and we're going to go ahead and reassess his motion then. And back down. And do you have a little bit less pain there?
Yeah.
Good, so then it worked and there was proper force because he had less pain with the movement, and the dosing is going to be 3 sets of 10. So the next thing we're going to do is teach the patient a self-stretch for the Levator scapulae. And here's my patient, and she's having some tightness on that right side. And I'm going to go ahead and just have her perform that motion to the side, and it's a little bit tight there, and it hurts. So what we're going to do is I'm going to have her reach underneath the chair, hold on with her right hand, and we're going to be going towards the left to make sure that we stretch that right levator scap. She's going to hold underneath of her chair. She's going to side bend away and then rotate her head downward to get that max stretch of the levator scap. And she's going to take that left hand and just place it on top of her head, but she's not going to pull. The hand is just going to act as overpressure. And do you feel that stretch there?
I do.
And is it causing you any pain?
No.
All right, you can go ahead and let go, and she would hold that for about 30 seconds and repeat 2 times, and she could also do the other side as well. The next thing that we're going to do is a scapular mobility exercise to improve scapular mobility and control bilaterally. And I'm going to start by having him do some scapular mobilization. So I'm going to have him sideline for clinician position. He is on a couch, so I'm going to kind of be on my knees to watch my body mechanics. I'm first going to assess how he's doing before. So how are you feeling today? How are your shoulders?
It's tight and it hurts.
So he's a little tight there, so we'll kind of watch that while we're doing those mobilizations. So I'll come around and palpate for his scapula here, and I want you to communicate with me during this, okay?
Okay.
And how are you doing?
That feels good.
And how are you doing?
That feels good.
And the dosing for this is going to be 6 to 8 seconds, 3 to 5 times, and then I'm going to have him switch to the other side. Move that pillow there. And do the same thing. I just want you to kind of communicate with me about how you're feeling, all right?
Okay.
Can you scoot closer to me?
Yes.
Thank you.
Feels good.
It feels all right?
Yes.
And how about now?
That feels good also.
Good. And again, that's 6 to 8 seconds, 3 to 5 times. And then to assess the control for this exercise, I'm going to have him go ahead and stand up. I'm going to demonstrate it first. Is place his arm on the wall here at a 90-degree angle, and I'm going to have him put that same foot back. And I'm going to have him kind of slide his arm up the wall and lean forward, and then come back down. All right, can you try that for me?
Yes.
All right, side up, good, and come back down. And how does that feel?
Feels good.
One more time. And come back down. So that's to work on that control, and then he would go ahead and switch and do the other side to make sure that we're doing it bilaterally. Other arm on the wall, and go ahead and slide up. Good, and come back down. And the dosing for that is going to be 10 reps, and he can repeat it 3 times on each arm. So the next thing that we're going to do is a median nerve glide for carpal tunnel on the right hand, and that's the technique that I've chosen to do. And I'm just going to pick her arm up, and I kind of want to assess her motion first. So can you go ahead and just bend your wrist for me? And does that hurt?
Yes.
And kind of bend it side to side for me. And she's a little bit limited with her motion there, so we're going to do these nerve glides with her. So I want you to just communicate with me if you're having pain or any discomfort through this, okay?
Okay.
So we're going to start, and your elbow is going to be on the treatment table, and you're going to start with your hand in a fist with both your fingers and your thumb flexed. And that's going to be your first pose. Are you having any pain?
No.
The next pose is going to be extending your fingers and your thumb out, and you're going to kind of keep that wrist in a neutral position. And are you having any pain?
I'm not.
And the next thing that we're going to do is bend your wrist back and your fingers back, and you're going to keep that thumb in that same position. And are you having any pain?
No.
The next thing that we're going to do is take that thumb and kind of point it outwards. And are you having any pain?
No.
The next thing is going to be flipping that palm, the face towards the ceiling. And are you having any pain?
No.
And the last thing that we're going to do is take that other hand and apply an overpressure to the thumb. And are you having any pain with that?
No.
And the dosing for this is going to be her holding, going through those sequencing 5 times and repeat 2 sets. And how are you feeling now?
I'm feeling good.
And can I go ahead and take a look at that wrist motion again? And how's your pain level now?
It's a lot better.
A lot better. Okay, good. And she is getting some more motion there. So the next thing we're going to do is a high-level strengthening exercise for the extrinsic hand muscles on the right hand. And I'm going to go ahead and have my patient here with his elbow on the treatment table. The exercise that we're going to do is for gripping strength, because that's going to work those extrinsic hand muscles. In the clinic, I would probably use Therex or a hand gripper, but right now what we have is a pair of kitchen tongs with a towel in between to kind of simulate that gripping motion. Before I start anything, I'm going to ask him just to show me and pretend like he's going to grip onto a handle. So go ahead and just show me what your grip looks like right now.
Okay.
So you can see where he has that motion, but he needs to strengthen it a little bit. So what we're going to do is place the kitchen tongs, and I'm going to have him grasp it below the towel here. And I'm going to have him go ahead and just squeeze and hold for 3 seconds, and then release. One more time. 2, 3, and then release. And this is to simulate that gripping motion and work those extrinsic hand muscles. And the dosing for this is going to be 10 reps for 3 sets, and he's going to hold the tongs for 3 seconds at a time. And then once he's finished with that, we're going to go ahead and just assess his hand motion again. And he's got a little bit more strength there. And did you have any pain with the exercise?
No.
So we will go ahead and keep that in his treatment program.